Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Christina Johns. She's a physician executive. Today's Kevin MD article is Modernizing Healthcare with AI and Workflow. Christina, welcome to the show.
Thank you so much for having me. I'm really delighted to be here.
All right, so before we get into your article, just briefly share your story.
Sure. Yeah. So I am a pediatric emergency physician by training. So pediatrics, then fellowship in pediatric emergency medicine. Thought I was going to be in academic medicine forever and did the tertiary children's hospital emergency department thing. And then kind of fluky joined a startup where that was really where I got the bug to lean into innovation and some strategy and communications work. And so that led me to where I am presently, working for a company that is called IKS Health, where our mission really is to make the physician, the clinical experience more about patient care and less about the administrative activity. So more getting back to core versus chore, as we say.
All right. So,
Yeah.
as you know, we live in a very exciting time, various
Yeah.
AI-related tools. It's a little bit of the Wild West. A lot of healthcare startups trying to best utilize AI and incorporate it into physician workflow. I see that all the
Yeah.
time on this podcast and in my work as a primary care physician. So, tell us about your Kevin MD article and your vision of integrating AI in our workflows.
Yeah, I think that clearly AI is not going away. I think that the key piece is to be very mindful about it. And I think what I really liked and what I really like about what I'm doing now is the real acknowledgement that AI needs to be monitored, kept in check, and always kind of working alongside, we call it human in the loop.
Yeah.
So making sure that there really are a ton of those checks and balances. But what I think that the biggest piece that is important, and as doctors, gosh, I don't think that we're really very good at understanding the real nitty gritty and the look under the hood of some of these AI solutions and responses and other vendors, for example, that we use in the workplace, whether it's our EHR, whether it is other dictation, whether it's the back end in billing for some of us. And what I really like to see are what we call sort of the connected workflows, where AI can really work across the continuum of the patient visit, really. And so that way it saves time. It is oftentimes a good safety check and balances. There are a lot of good use cases for it. So I'm a believer.
When you say physicians don't look under the hood, so what are
Yeah.
physicians missing when it comes to a lot of these AI related tools?
I think that people don't really understand kind of what they're really getting. I think number one, I think physicians don't understand the full value. Oftentimes, whether you're part of a hospital, whether you're part of a big group practice and you just sort of get handed, hey, I guess we're going to use this vendor,
Mm.
this EHR, or we're changing billing. Most physicians, I think, don't really understand what goes into that. Well, the decision making, what's the ROI, what's the real value add. We're doctors, right? We care for patients, and that's what we do. And sometimes the rest of the patient experience, the business experience, really doesn't happen for us. And I think it's important that we all do that.
So tell us exactly which tools are we talking about? Of course, there's a whole genre of AI
Yeah.
scribes, and now we have AI trying to be incorporated into the workflow. So tell us the specific tools that you're referring to in this specific article.
Yeah. So, there are certainly the scribing piece, right? That is the most obvious one, and that's the one that doctors use. But there are other types of AI tools that can be used for example, for automated prescription refill.
Mhm.
Kevin MD's on a statin. He's been on a statin forever and a day, and he needs a prescription refill. And so you can use AI to sort of determine, has there been a lipid profile for Kevin in the most requisite amount of time before the next appointment? Get that lab started. AI can be trained to do all of that kind of stuff with specific workflows very automatically, so that it can save you time and make the patient experience better too.
So when you said that sometimes physicians don't know what goes on behind the hood or under the hood,
Yeah.
and they're just
Yeah.
given a tool. So are there specific differences between the vendors, or are they specific questions a physician should ask before using a particular AI tool?
Yeah, sure. I love that question because I think that's really gets to the heart of it, right? When you are in practice and find out that some new solution is coming your way, I think first of all, it's important to understand what exactly does it do? What is the expected ROI? Is this saving me time? Is this saving me money? Is it both? What's the patient's journey look like? What does this mean for the rest of my coworkers and my staff? And I think the other piece, and this is the part that really gets me, is how does it connect to other parts of my workflow? We've got a point solution vendor for our scribing. We've got a
Mhm.
point solution vendor, a different vendor that's doing scheduling, a different one yet again for all of our billing and rev cycle. And I think that those types of things are understand how does it work together, and is there a place where that can be all connected?
In your article, you wrote that 77% of physicians are dedicating significant time to non-reimbursable tasks. So tell us about how AI can alleviate some of those tasks for physicians. We briefly talked about things like AI scribing and
Yeah,
prescription refills. So speaking today, this episode will go out in early January 2026. What are
yeah.
some of the common ways AIs can reduce some of those non-reimbursable works?
Yeah, I think that the system can be taught for on the business side, certainly, for insights into patient scheduling
Okay.
so that you don't have gaps there, and your staff isn't. Again, I'm really thinking about this not just as physicians, right, as the whole clinical team, because I think it is important to acknowledge that that's how the operation hums, right,
Yeah.
when everything works together. And so it is thinking about schedule optimization, things like that. It's You can use AI for your staff for calling, for reminders, for example. You can use it, as I talked about, the for prescription refills, for abstracting data from the medical record, from the chart, so that you're not fishing around. Where on earth was that CT report from 8 months ago? Things like that. I think that we're really headed into a brand new space where there's not only clinical efficiency, but business efficiency as well.
And your hope, certainly, with these AI tools and decreasing the amount of non-reimbursable work that can help physicians practice at the top of their license, right?
That's really the thing, right? We want to get back to doctors being doctors and doing what we do best, spending more time with our patients, not rushing in with your laptop and not looking at the patient, tapping away at the keyboard, just so that you can get through your charting with maybe only an hour left of extra charting at the end of the day, for example.
So there have been studies, as you know, recently with these AI scribes showing that
Yeah.
the time saved per visit is actually quite nominal, but the major benefit is with decreased cognitive burden, decreased burnout. So is there clear data from your end showing that with AI scribes, for instance, do they really decrease a significant amount of charting time?
Well, they certainly can. Again, this is a really hard one to answer, I think, on the individual level basis, on an individual clinician, because I think there is some work up front. Most of these types of machine learning, they learn as they go. So the
Yeah.
more that you use them, right, the better they are. So I think it can be a tricky answer. And I get it why the data is, a little bit all over the place right now. So I think that's why I think doing some of the front end work as a clinician, as you evaluate the potential use of some of these tools to make sure that it will fit right for your workflow and your practice, as not just you but the rest of your team.
So let's talk more from an organizational standpoint. And
Yeah.
you mentioned that only 13% of healthcare leaders have a clear strategy for integrating AI. So that leads me to think that a lot of them are using it kind of in a piecemeal or a haphazard fashion. So tell us
Yeah.
more about the stories behind that statistic. What are you seeing in terms of how organizations are implementing AI, and do they have a comprehensive AI strategy at all?
I think that's the new frontier, right? That's where I think that organizations are really, and we're going to see more of that. I think getting with the program, having a chief AI officer, for example, who can really help have a coordinated, integrated strategy in larger health systems. But I think that's a big issue because, you've got the back end office people think, hey, here's a great tool here. You might have the
Yeah.
front end scheduling folks, and it's all different and not connected. And when it's not connected, it can't work together to really maximize the potential impact.
So you are, of course, you mentioned a pediatric emergency physician, and now you're in a health AI startup, right?
Yeah.
So I think that talk to me about the voice of clinicians when it comes to developing these tools. Tell me how important your clinical experience is when it comes to introducing new tools, and in general, do these AI startups, do they value the input of practicing clinicians?
Yeah, this was one of the key points that drew me to this organization was that it was just such a priority to have a team of clinicians who really could speak out and not just, oh, hey, this is a great idea, comment on that idea, but this is really what practice looks like. And so this is what will work, this is what doesn't work. The notion of being data driven and testing a solution, I think was a really big piece. And so I do think that, look, gosh, we doctors, we can be a tough tribe, right,
Mhm.
when it comes to having new products and solutions introduced to us. And so I think that any company that is worth its salt will absolutely have clinicians on, if certainly consulting, if not part of the team as they construct their offering. And so that was very, very important to me as I was, when I made my job change.
In pretty much every field, people are worrying about AI taking other
Yeah.
people's jobs and really
Mhm.
impacting the human workforce. As it relates to healthcare specifically, how do you see the infiltration of AI affecting the human healthcare workforce?
Gosh, look, I'm a real believer that AI is never going to replace humans. That just doesn't work, right? And it doesn't work in the concept of healthcare because of the second syllable of that word, because of care, right? I think that there's always going to need to be the human connection, and I will fight like heck to make sure that that is something that always sticks around. It's got to be something that enhances your job. It doesn't replace it, and it isn't just physicians. It is, I think, every staff member along the patient journey. And I think that that's important. It should enhance what we do. It should make us better. But it needs to make us better for the as we care for our patient, not as any machine learning does.
So, what do you see in the immediate future, the rest of 2026? What are some of your crystal ball predictions as it relates to AI and the physician workflow? What's coming down the pipeline?
I think that as with a lot of new technology, right, there's this kind of honeymoon phase, and then there's a little bit of a disillusionment phase. And I think, the question is, are we in that disillusionment phase where there will be a lot more critical appraisal of these tools as more of them are coming out into the market? Will there be more, end-to-end comparison of them? I think there will certainly be much more solid, robust, data-driven literature about them, about their capabilities, about their shortfalls, how they can be improved. And I will love to see that refinement of the tools that are doing well, that are consistently showing up and working for physicians. I think also there's going to be more of a comfort level that we have as a profession where we're getting used to that in our workflow. And then when I think we're more used to it, then we have a stronger voice to be able to really call out what's working and what isn't so that we can refine this, make it work for us, and mostly make it work for our patients.
We're talking to Christina Johns. She's a physician executive. Today's Kevin MD article is Modernizing Healthcare with AI and Workflow. Christina, let's end with some take home messages they want to leave with the Kevin MD audience.
Fantastic. Thanks so much for having me, first of all. Second of all, what I would say is, again, understand what you are getting. Don't be afraid, but understand what you're getting. That means ask the questions. Let me see a demo. How does this work? What is really the value? And then what are the gaps in my own current workflow that need to be addressed? I think so many times people think, oh gosh, this is new and flashy. I must have it. But make sure you understand what your pain points are before you jump in.
Christina, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you. Appreciate it.